Hello, this is Ed Pruitt. I'm editorial director with NEJM Catalyst, and I'm on the line here with Dr. Jun Zhang, who's a fellow, MD, and postdoc associate in the Department of Orthopedics at Zhejiang Provincial People's Hospital in Hangzhou, China. He is from Hangzhou, but has been called to Wuhan as one of a number of healthcare workers called to Wuhan to deal with the COVID-19 epidemic there, or it can do a pandemic. So Dr. Zhang, thank you for joining us. And would you please describe the situation with COVID-19 in Wuhan, both at the peak of the crisis and currently?
Okay, thank you so much for your question. Actually, I have been in Wuhan for more than 1 month now. It is a really tough period for the people living in Wuhan during the past 3 months. As far as I could remember, when we talk about the peak of crisis, there are more than 10,000 cases confirmed one day in Wuhan. Although at that day, most of them are diagnosed based on clinical diagnosis. And in these cases, no test was performed, but diagnosis was made based only on their symptoms, exposures, and also presence of non-emergent features consistent with coronavirus pneumonia. After we clinically diagnosis criteria, the clinical diagnosis criteria was used in Hubei province only during that time, because during that time, not enough kit is available. So we did that, try to find out all the suspected cases and try to isolate them in the mobile camping hospitals, which you guys probably know it already. It's newly built. And we use the city's sports stadium and the convention centers to offer more beds for these patients, which we call mobile camping hospitals. By the way, in the last week, I read from the news that the Spanish people is doing the same thing as well. And in order to overcome the shortage of medical staff in Wuhan, there are more than 41,600 medical professionals that was called for aiding here. So a lot of medical professionals from Wuhan city as well as other parts of China were dispatched to those mobile camping hospitals to take care of the patients. But as you know, I guess we only treated mild type of COVID-19 patients, which means they only has non-pneumonia or not mild pneumonia. If the patient shows any signs of severe or critical type, we will transfer them to the designated hospital, which including the two new built temporary hospital like Huosenshan and Leisenshan Hospital, and as well as many designated hospitals, for example like Zhongnan Hospital or Jingyingtan Hospital. But actually, after working like this for 2 months, so far I would say everything gets much better than before. And many designated hospital, which one of them I worked for like 1 month, it's Zhongnan Hospital. We have step by step go back to normal work nowadays. And they transfer all the left cases to the 2 temporary hospital and the other 7 designated hospital. So good news is that for the past 3 or 4 days, there is no new confirmed cases in Wuhan and even in entire China, because the only increased cases were coming from outside of China when they get back to China. So this morning I read news about COVID-19 because I read it every day. I found that there are less than 4,700 cases here in Wuhan so far. So among them, about 1,699 cases were severe or critical type. So I'm very confident that we're going to finally win this people's war that's named by our President Xi. I guess we will win the war in the near future.
That is great news, to go from 10,000 cases a day down to only a few. Remarkable story. Now, you are an orthopedist. So what has been your role in Wuhan as a visiting health worker?
I'm one of the 41,600 medical professionals here in Wuhan. Our hospital, as you mentioned before, which is Zhejiang Provincial People's Hospital, we in totally send out 4 teams here for aiding. And the team I work in, we have 172 doctors and nurses, because there are not enough doctors in the specialty such as ICU or such as respiratory systems. So we also send some of surgeons here for helping. And actually, we arrived at Wuhan on February the 19th, 2020. At the first time when we arrived at Wuhan, our mission is to take care of the severe and critical cases in Zhongnan Hospital of Wuhan University. We have taken care of 50 to 60 cases, and every single case recovered very well and go back home already. And on March the 10th, 2020, due to the number of cases confirmed with COVID-19 decreased very fast, so some designated hospital is planning to close down and to go back for normal work. So all the left cases of Zhongnan Hospital has been transferred to one of the temporary hospital, which called the Lei Shenshan Hospital. So after that, our team was moved to another designated hospital, which is Jingyingtan Hospital, to take charge of a department. There are around 30 severe and critical type of COVID-19 cases there, and this is what we are doing right now, and we are taking care of the cases in Jingyingtan Hospital.
I see.
Mm-hmm.
Now, how did Zhongnan Hospital at Wuhan University adjust its delivery of care? Was everything devoted to COVID-19 cases for a time, or were other routine care and acute care cases also happening?
Mm-hmm. That's actually a good question, but I'm not 100% sure for this part. You know, as a visiting medical professional, we actually pay more attention to our daily work and try our best to stay away from contracting the virus. So, however, as a designated hospital of COVID-19, as far as I know, Zhongnan Hospital of Wuhan University, they set up 2 different passageways. One is specific for COVID-19 cases or suspected cases, and the other one is for regular cases without COVID-19. So, but all of the elevative surgeries and regular clinics was postponed, and only emergency surgery or patients will be taken care of. Even if they met some emergency surgery, they will check if the patient has COVID-19 or not. If they were confirmed with COVID-19, they have a standard protocol for the steps followed up. And I know some surgeons here, they also performed emergency surgery, even spine fracture surgery for patients with COVID-19, but with appropriate PPE, obviously.
And Dr. Zhang, you mentioned that the healthcare workers were doing their best to avoid getting sick as well. How did you accomplish that? Was there enough PPE?
Yeah, it's also a good point. Actually, it is always very important to make sure that medical professionals to stay away from the virus when they helping patients. In order to achieve that, we have very specific protocol for preventing people-to-people transmission, not only in hospital, also in our temporary housing. In hospital, I guess the appropriate PPE will be the best way. But for the temporary housing, we also write up a letter for sharing our experience, and we guess we will submit it for publication soon. And also, everything we done in the temporary housing, we recommend to avoid people getting together, and we also recommend to wear the surgical mask. So when we need to teach something or we need to meet and talk about something, we basically doing it via some softwares like WeChat or DingDing, some softwares that can help us avoid to getting together. And other than that, we made a video actually for the appropriate guideline for PPE and about how to put on and take off PPE during the COVID-19. And actually, as you just let other people know that, we made a video in both Chinese and English version. And if it's helpful for other people, we will happy to share it. So, yeah.
Yes, please do. So we would we'd be very happy to share that. So the keys are personal protective equipment and social media.
Yes.
So now cases of COVID-19 are shooting up in countries around the world. Spain, here in the United States. It would seem there are a lot more to come. So based on what you and the others learned in Hubei province, what should hospitals and healthcare workers, medical professionals in other countries be doing right now?
Thanks for your question, but actually it's a tough question for me because honestly I would say it is still a little bit too early to draw a final conclusion which way is the best way to prevent COVID-19. But however, from what we see and here in China, the fact is that nowadays in Hangzhou, the city I live, there is no new cases in the past 30 days except the importing ones. And here in Wuhan, everything is also in good control. And in the last 3 or 4 days, no new cases as well. So what we did here, I think, so as far as we can tell, it works very well here. And also, other than that, we are sending a team of medical professionals to Europe, I think to Italy, try to help them to also provide them with more medical facilities and some medical professionals for try to help them to dealing with the terrible virus. Other than that, I would say this point may be interesting because for the regular people, we have a strategy that we used in Hangzhou at least. I don't know because I should stay in hotel and also in the hospital. I'm not allowed to leave hotel during regular day in Wuhan. But I know the life there in Hangzhou, what normally people can do, because there is a strategy that we used a dimensional barcode, which is on your cell phone, and it is based on the big data and the system of Alipay, and your cell phone can tell where you have been and which people you have met. Then if you want to go to a specific area, you should show your barcode on your cell phone, and if it's green, then you can go. Other than that, if it's yellow or red, which means that you probably have meet some people confirmed with COVID-19, or you come from some area that it's dangerous, and you may be has high risk of contraction of the virus. So you should be isolated at home until your dimensional barcode turns green after a certain period of time. I think if the other countries can set up a system like this, which can help the medical professionals to tell which patient maybe has lower or which patient has higher risk for the COVID-19, then it can help at least a little bit to the spread of the COVID-19 virus.
Well, that's fascinating. I've heard about a similar system of big data tracking in Singapore, and that has great ramifications for society. So just like to end by asking if you could hazard a guess, what will healthcare delivery look like in the future? Will it be different than in the past? You mentioned there are no new cases in Wuhan. Should everything go back to normal, or do we have a new normal now?
I guess the situation in Wuhan, personally, I would say maybe in the next 1 month, everything gonna be back to normal. I mean, nobody can 100% sure it can be, but from what we see these days, the COVID-19 numbers goes down quickly, and in the future, what I wish to see is that all of the countries can work together and will help each other during the outbreak of the pandemic, and also during our regular days, we should get ready for a potential outbreak of pandemic. So if one day it actually happens, I guess we can do much better than now. So that's just I wish, yeah. And also, I heard from the news that the vaccine has been developed, and now it's during the clinical trials now. So I hope the vaccine they developed can be helpful for the peoples from contracting the virus.
Well, that would be, we all hope that a vaccine is in the near future. Dr. Zhang, thank you very much for talking with us from Wuhan. These are fascinating lessons, and we look forward to disseminating this on NEJM Catalyst.
Okay, thanks. My pleasure.